Hello, everyone, and welcome to this week's weekly virtual training session presented by Africa Fire Mission. My name is Mike. I'm a project coordinator with Africa Fire Mission, and we're happy that you took time out of your busy schedules to join us today for today's training. Today, we've got another local instructor teaching today. We've got Richard Gichina with us. We're going to be talking about some soft tissue injuries. If you stick around for at least 70% of today's training, which is usually 40 or 45 minutes, you'll receive a certificate of attendance. When we complete today's training, there'll be a tea time afterwards where you can stick around and ask questions about today's training or about any other topics that may be on your mind. So I invite you to stick around for that. I'll put some information down in the chat where you can reach our Google folder or Google Drive folder that has access to today's training as well as all the other trainings that we've done so far this year, and you can watch those trainings and answer a few questions, and you'll receive a certificate of attendance for those trainings as well. Before we get started with today's training, I'm going to pass it over to Jose, Africa Fire Mission's fire safety advocate, for a few words of encouragement.
Thank you so much, Mike. I truly appreciate you. Today also today is my word of encouragement. Today morning I was just called with a distress call that there's a situation here in Mathare and there's some houses burning. But then these houses that were burning were started by wrangles from the different communities. In Mathare, it's a cosmopolitan kind of village, urban village, but they were fighting. And one of the communities threw fire in that area and fire started. And when Nairobi Fire Brigade responded to that fire, their engine was blocked, you know. And it got me thinking, but at one point, blocked by the residents not to go to extinguish or put out the fire. So they're in the middle of people who want to kind of like stone them. Now it got me thinking later on when I got back to the office. These guys had so much courage. You know, the firefighters had so much courage to drive all the way from the Nairobi station and come in the midst of people who they don't know to actually help them. But these guys did not want help in that particular point. So that got me thinking, in this courage that we usually talk about in the fire service, what does it really mean? You know, we say courage under fire, you know. So for me, courage is when everybody is safe. Now for us as firefighters, everybody knows what to do. Everybody knows each person's weaknesses and strengths. And how do we get to know that? By being around each other, by providing for each other confidence. And at the end of the day, all of us get to go home. Yes, the police came and that particular problem was sorted out. So for you as a first responder, how can you define courage? Yeah, I'll leave it at that so that it can be food for thought. Yeah, how do you define courage in your workplace? Back to you, Chief Mike.
Thank you very much, Jose. We always appreciate you being here, providing those words of encouragement. And as I said previously, be sure to stick around afterwards. Jose is going to be hosting our tea time after our topic of the day. So speaking of our topic today, we're going to carry on with our EMS theme. So at this point in time, I'm going to pass it over to Richard to get us started. Go ahead, sir.
Thank you so much. Thank you so much, Mike, for always being here to remind us about the goodness and the fun behind being a firefighter. Jose, thank you so much. You've been of much help. We've been up and down. I'm still very far away. Today I'm not displacing you in your office. Today I'm actually I guess around 400 kilometers away from you. So I can't distract you. For the fellow firefighters, welcome to the training. We're still continuing. By the end of the day, we want to achieve something in the EMS or in the first responders, because we always say something, every day is a learning day. And the day that you don't learn, you have not spent the day. It's like a wasted day. So today we are continuing with the topics as just a minute, as we started last week but one, with the training with Dr. Eve. Last week we did. So we're still continuing. Hopefully everyone can see my screen. Is it watchable? Good. So just a quick one. How many of us can remember this day? You can write on the chart, you can talk. In this picture, does this picture bring anything, any clue to yourself? Jose? Do you have an idea of when was this picture taken?
Yeah, that was in at the CID headquarters in was it 2019 symposium? I'm not so sure.
Well, it was 2021.
2021. All right.
No, 2022, last year. Yeah, 2021 symposium. It's only had this one at the CID. If you look at this background of this picture, it has a lot of firefighters. And by mark you, no single firefighter. They were from different departments. It means firefighters all over the world, we can complete and make one, because we have a duty to act, which is to fight fires. So thank you so much for coming in. Thank you so much for finding some time to our session. Our topic today is soft tissues injuries. We always ask, these are injuries that are that occur in a workplace, and most of the time you'll. Muscle is, last time we learned about bones. Now today we are learning about muscles. So after the first thing, scene of accident or road traffic accident, what do we check? We always have to do the sensitize up. Sensitize up means you do a 360 of what you of the scene that you are. Then remember one thing: it is not something that we can talk about. It is not something that we can say like, I can bypass this one. Oh, this one is not important. Sensitivity and sensitize up is the key. What does it entail? It entails you going round, either by eyes, either physically, walking around the eyes. You can do it. Look right, look left, look right, look left, look north, look east, look south, east, west, east. If there's something like that, you will look at them. Then you see what is there. This means if it's an accident, how many vehicles do we have? It's animals. Do I have an elephant? Do I have a lion? Do I have a cat? Do I have a dog? Do I have a cow? Then the environment. How do you relate the environment? It is cold. Is it hot? Is it watery? It is locky. Is it slopey? That is the environment. Then hazmat. These are hazardous materials. Do we have diesel that has poured all over? Do we have petroleum? Do we have gases? Then hostile people. Like what, if you can relate hostile people with what Jose have talked about in the word of encouragement, That was a hostile person or a hostile crowd. Then, after you do all that, the next step is we need to identify ourselves. We are firefighters and we are here to help. But do we always do that? We always say like, yeah, I'm a firefighter, we're here to help. We always go in asking, where is the fire? Why is everything? So although it happens, then we need to ask ourselves or ask the callers or where we are, what is wrong? What happened? How many are involved? Like if you look, it's a house. Like what happened to the house? What is inside the house? What time did it start? Then the other thing is, number one, we put on the PPEs. PPEs must be there, put on the gloves, put on the helmets, put on boots, put on the bunker part, turn out the BAs, and then we move on. Number one, when there is injuries or in EMS or in first aid and first responders, you say one thing. These three are the major systems in our body. Number one, we have the lungs, or what we call the respiratory system. Then we have the blood vessels, heart and blood and everything else. These are what we call now the comprises of circulation. So remember, in respiratory, we look at airway and then breathing. After that, we do circulation. Circulation means you check if the heart is beating. Yes. So do I have any blood that is flowing outside the patient or outside the victim? Yes. If there is a blood that is flowing outside the victim, you cover the wound, either by direct pressure, you put bandages, or indirect pressure, or a tourniquet. Then the nerve system. The nerve system is what we call the sensitivity system. You can check by what we call we check how close the CSM, the sensation, motor, and motor. So you check on that. If you want to check on the hand, you can try to ask them, which finger am I holding? You can try to ask them, can you feel me pinch your finger? Can you feel me pinch your hand? Then I want us to watch a small video. We will watch a video here. Hopefully it's audible to everyone. Kindly, if it's not audible, you can share on the chat or you can raise your hand.
Heart is a pump. It's a muscular organ about the size of your fist, located slightly left of center in your chest. Your heart is divided into the right and left side. The division protects oxygen-rich blood from mixing with oxygen-poor blood. Together, your heart and blood vessels comprise your cardiovascular system, which circulates blood and oxygen around your body. In fact, your heart pumps about 5 quarts of blood every minute, and it beats about 100,000 times in one day. That's about 35 million times in a year. Oxygen-poor blood, blue blood, returns to the heart after circulating through your body. The right side of the heart, composed of the right atrium and ventricle, collects and pumps the blood to the lungs through the pulmonary arteries. The lungs refresh the blood with a new supply of oxygen, making it turn red. Oxygen-rich blood, red blood, then enters the left side of the heart, composed of the left atrium and ventricle, and is pumped through the aorta to the body to supply tissues with oxygen. 4 valves within you.
Sorry for that.
Your heart muscular organ, slightly left of center in your chest. Heart is divided into the right and left side. The division protects oxygen-rich blood from mixing with oxygen-poor blood. Together, your heart and blood vessels comprise your cardiovascular system, which circulates blood and oxygen around your body. In fact, your heart pumps about 5 quarts of blood every minute, and it beats about 100,000 times in one day. That's about 35 million times in a year. Oxygen-poor blood, blue blood, returns to the heart after circulating through your body. The right side of the heart, composed of the right atrium and ventricle, collects and pumps the blood with a new supply of oxygen, making it turn red. Oxygen-rich blood, red blood, then enters the left side of the heart, composed of the left atrium and ventricle, and is pumped through the aorta to the body to supply tissues with oxygen. 4 valves within your heart keep your blood moving the right way. The tricuspid, mitral, pulmonary, and aortic valves work like gates on a fence. They open only one way and only when pushed on. Each valve opens and closes once per heartbeat, or about once every second. A beating heart contracts and relaxes. Contraction is called systole, and relaxing is called diastole. During systole, your lungs and body, much like ketchup being forced out of a squeeze bottle. The right ventricle contracts a little bit before the left ventricle does. Your ventricles then relax during diastole and are filled with blood coming from the upper chambers, the left and right atria. Then the cycle starts over again. Your heart is nourished by blood too. Blood vessels called coronary arteries extend over the surface of your heart and branch into smaller capillaries. Here you can see just the network of blood vessels that feed your heart with oxygen-rich blood. Your heart also has electrical wiring, which keeps it beating. Electrical impulses begin high in the right atrium and travel through specialized pathways to the ventricles, delivering the signal to pump. The conduction system keeps your heart beating in a coordinated and normal rhythm, which in turn keeps blood circulating. The continuous exchange of oxygen-rich blood with oxygen-poor blood is what keeps you alive.
So that was part of circulation. In the general, circulation means it's the blood moving around and round and round and round in the body. So whenever you find blood that is running out of the body, it means we have a deficiency or it is not right. The circulation contains, it will be said, it contains the heart, the blood veins, arteries, and the blood. For circulation, we check the pulse. Pulse that is only in a few we'll see some pulse point, basic pulse. It's when you get the number of beats, the heartbeats per minute, and it has an average of around 60, between 60 and 100 beats per minute for an average adult. So here you are, the central points. We have the carotid. If you try to hold on your neck, slightly below the ear, you go down with this jaw. When we have the jaw joint, here you go down, you will feel a pulse. That is what we call the carotid. Then we have the femoral. The femoral is right below it's right at the corner of the hip, or where the hip and the pelvic joint. Then you have the apical. Apical is the heart itself. We have radio that is on the hand here. Slightly, when you stretch your hand, you come down through the thumb, and there is a kind of a groove. That is where you get the radio part. Sorry for that. Then you have the brachial. You always find it is very, very, very easy to locate it with the kids because the artery. Then we have the posterior tibular on the feet or on the leg. We have temporal, which is found here. You always have some when you go for a shave, or when your headache you have a severe headache, you feel like the sides of the head are pumping blood. That's the temporal. Then you have the popliteal, which is behind the knee. Here it is. That's a position of the carotid pulse. And then no circulation, you do CPR. CPR, it's hands-on. We do 30 compression for for 30 compressions and 2 breaths for adult, and for infants or kids or babies, we do 15 compressions and 5 breaths. The difference between schoolgoers or the teenagers, for adults, you do with both hands. For schoolgoers or teenagers, you use 1 hand. But you also do 30 cycles, 2 breaths. You do 30 compressions. Then at this point, we're going to run about soft tissue injuries. We are still continuing. We have 2 types of we have 3 types of soft tissue injuries. Namely, they are closed. There's one that is you got injured with a blunt trauma and the skin was not open. And then we have the open one, when you have the skin is open and the blood is oozing out. And the other thing is they can also be caused by burns by chemicals, burns by a hot liquid or hot water or porridge. Controlling them, number 1, the treatment for this for soft tissue injuries, that is closed or open or burns. Number 1, you have to make sure that the victim is relaxed. For open wounds, you see, you apply direct pressure to the place that the injury is or where the skin is cut open. Then the other thing is you apply dressing. And if you apply dressing and they start soaking on blood, please, you can remove the other layers except the first layer on the wound. The first layer that you pressed on the wound, that one does never come out. So you only add layers, and if it's too bulky or it's too huge, you don't remove all of them. You remove maybe the last you installed and change to another. But the first dressing that is in contact with the skin, please don't remove it, because now if the clotting was on process to start and you remove that bandage, it means clotting is a continuous process. Then also in soft tissue, it depends also with them. For you to have either a closed or an open, it depends with the mechanism of injury. If you're hit with something that is blunt, for example, a piece of wood, it won't, 90% chances is there that it won't cause an open wound, but you will have some injuries from inside. So that one will contribute. Then the other one is penetrations, when you walk in on wood, and then you spiked by a nail or a needle or a thorn. Yeah, we have very notorious thorns that are known to do that, or even a piece of grass, or when people are fighting and then a piece of a knife is impaled in the body. So those are examples of penetration traumas. Then we have the barrel traumas. Barrel traumas, they are caused mainly by change of altitude or change of pressure, either the air pressure or water pressure. If you look at the guys who go diving for so long, the pressure can injure you by collapsing the body organs from inside. Then when you have a long flight and the plane is not well ventilated, you end up hearing some, mostly it affects on the ears. Mostly affects the ears, sorry for that. As we continue, so we say number 1, you can do either direct pressure or indirect pressure. Direct pressure is when you put the hand on the wound, the gloved hand. And if you are doing anything, make sure your hand is gloved so that you can prevent yourself from gross communication or gross contamination from the patient's blood to you. Then the other thing is the gloved hand, put direct on the wound. You can that is doing direct pressure. For indirect pressure, you can locate the carotid or which are also known as the pulse point. And you can press against the bones or against the muscle so that you can see if you get further to that expression. The other one is after you do that, you pack the wound, apply dressing on the wound, and then you secure the dressing with a bandage. We still continuing shock. If you have an open wound or a closed wound that is on the major tract, or is on the major cavities, example, the lung cavity, the stomach, the abdominal cavity, and also the pelvic cavity. It means that patient or the victim will lose a lot of blood because some of these, you look at the stomach, it has a lot of spaces that the blood can settle down. You also have the chest, it has a lot of space. You have the pelvic, it has a lot of space. So one thing with shock, it is a life-threatening when the blood is rushed. Sorry for that. Now then we actually, yes, it is emotional, it is psychological response. So at most is not always a life-threatening when he's on the initial stages, but when it goes to extreme, we say that this person or this victim has to be checked to a hospital. Shock, mostly we have the two of them or three. We say like the pulse is it's elevated. So the heart is beating so much, the heart is racing, the heart is beating so much at a high rate. It is beating for more than 100 beats per minute. Then also respirations, this person will tend to breathe very fast. The person will tend to breathe as fast as possible so that they can be able to compensate on the lost blood with the air. Then the skin of the color, they will be cool, they will ashen, or they'll lose the skin color, and also the skin will be dry because they don't have nourishment water. Symptoms as compared to body temperature. At some point, the body will try to maintain its pressure, but temperature. When as time goes, that is when it will have to lose, so that it can't be able to control its own. Uncompensated shock means there is not enough blood. So this is where we always encourage the patient, or we encourage ourselves, we can use fluids, the right fluids. Example, the ringers Roctate. We can use normal saline. We can use other medications so that we can boost on their blood. This happens when someone is losing lots of blood. So we continue when this is just a philosopher or the four learners who always say one thing: when you save life, it is as if you have saved the entire world. Those two guys that you saved, they might be fathers, they might be. Sorry, I guess I'm a little bit tired. They are their fathers, their mothers of the world, their brothers, their sisters to someone else. So any point you have and you want to save a life, and you have the obligations, and you have the will, and you have the resources, please do that. Then the other thing is, we don't raise two occasions, we raise when you fall back. When you fall back on our trains, when you fall back to occasions, fresher courses, and so that we can keep ourselves occupied. The other thing we need to chat, I wanted us to touch about, skin has got so many. It is the key number one for blood for our body to live. So the moment we have an open wound or an incision, it really messes the skin. Remember the layers of the skin, we have the epidermis and the dermis. The epidermis, which is the tough layer from outside, and the dermis, which is the softer layer, or the layers with hair follicles, blood vessels, and the subcutaneous oils. That is the dermis, which when bacteria from outside or infection from inside can get into the wound, then the wound is infected and will take a lot of time for it to die. Then when you have a broken skin, also we tend not to control our temperatures with the right attitude. Then as we continue characteristics, some of these characteristics we said we have to ask for his history. Remember the first few slides we said you need to ask what happened, so that now you can have an idea of what to expect or to have a mental picture of exactly what you need to do. The other thing is these victims will always tell you it's so painful in this point. It is very painful. So if they tell you it's painful, you have to manage it. Then by the end of the day, or it swells when you stay there. And the other thing is it decolonizes. I know some of us have been using these hammers to drive nails into wounds, drive nails into concrete. And then by bad luck, you hit your fingers like no one's business. And in a few hours or in a day, then you find out that something blackish is has already developed below the skin, which has discolorized. And we can also find like it can be pink, it can be black, it can be blue, depending with the energy or the mechanism of injury. Then you'll see blood. That blood has collected below them. You'll find blood that has collected. You have closed injuries. Then these some examples of wounds, or some examples of for these cuts. We have some examples. We have abrasions, lacerations. We also have avulsions, which means the skin have been pulled off, and we talked about penetrations. We can touch a little bit on blasts, blast injuries or explosion injuries. We have three types of injuries. We have the primary injury, that is the pressure on the injury primary, or what called on the hot zone. Then we have the secondary. Secondary means you're on a warm zone, or an object free from the explosion, or the place that, or the material that has exploded. It flies to you and then hit you maybe in the head, in the stomach, in the chest. Now you sustain what you call a secondary injury. Then remember to treat it with the same: apply direct pressure, apply direct pressure, indirect pressure, and then we continue. You make sure that the victim or the patient goes to hospital. As we move on, we have tertiary. Tertiary injuries, they occur when someone was on the scene. They were not exactly hit by either the primary or the secondary, but that person was thrown out of the explosions to or into an object. Maybe from here there was some sharp object outside the house or the other side of the road, and then the guy was injured. Now we get the tertiary. Then on assessment, if you arrive at such a scene, number one, we do assessment. We do synthesize up. Then we do assessment. On the primary assessment, that is when we have to form like a mental picture of the scene, or what we call the general impression. Then after that, you approach the victim. We said number one, we have to check airway and breathing, because these two will kill the patient or will kill the victim faster. And then the other thing, check circulations. Then after you check circulations, that is when you come up with a transport decision. Is it a patient that I can stay with here or stay and play with here, or a patient that I need to load and move on? So if there are major, there are minor injuries, make sure you check the major, visit the hospital that is close to them. If you don't have an ambulance to be with you, please kindly call an ambulance so that you can be helped at the hospital. So the other thing is treatment. We say you use the word RICES, RICES, which always dictates one, you have to make sure the person rests or the point of injury has rested. You calm down the patient so that you can control on their blood pressure or their panic attacks. Then the other thing is, if you have some ice on your ambulance, on your truck, for the guys who have trauma bags on the fire engines, you can use the ice, you can ice the place. Then the thing is, you can compress. Compressing means you can tie, you can tie not so tightly, but you can secure the bandages on side. Then you can elevate. If it's something that you can elevate, elevate it. If it's something that you cannot elevate, kindly don't elevate. Then you sprint. If you suspect each and every soft tissue injury, we always advise that you suspect like a fracture. So be sure to sprint that wound, so that by the end of the day, you take the victim and or a leg or a hand, you at least get out the pain to the patient. And by that, we get ourselves the end of the lesson today. And thank you very much. We stick for questions.
All right, if anyone's got any kind of questions with regards to today's topic, you can go ahead and put your questions in the chat, or you can raise your hand, or just go ahead and unmute yourself. Looks like we've got a question there. Collins, go ahead, sir. Collins, I saw you had your hand raised there. Do you have a question?
Hello.
Yes, go ahead, sir.
Good afternoon, team.
Good afternoon.
Yes, sorry I couldn't join the class earlier.
Question
I
or
just
also a
wanted some
comment. A comment also
clarification.
can be great. Not necessarily a question, but you can always.
Hello, you can hear me, sir?
Yes, go ahead.
No, okay. I just wanted a bit of clarification on the gauze you put on the wound. I just wanted you to throw more light on that for me. It's to help with blood clotting, if that's the case. The first gauze that you don't need to remove, you need to keep adding gauze to the wound if the patient is bleeding, just to control blood clotting, if I'm right.
Yeah, very true, Mr. Collins. We don't, if you had used and the second goes that the first goes that was in intact with the patient or in the skin, you don't, the first goes that is intact or that has a direct contact with the patient. That one you don't remove it, so that it will also help, it will also aid in clotting for the blood not to clot, and also helps you to manage the bleeding of the patient very well. Then the gauzes that we use, kindly make sure they are sterile and
Okay, thank you very much.
they are not contaminated.
See, we've got a couple of other questions in the chat. I see Adelino's asking, if you don't have a bag valve mask, what do you do to administer CPR?
Yeah, if you don't have the BVM or the bag valve mask, we have what we call the pocket mask. If you have a pocket mask, you can use that one. It is also, you can breathe in air. The pocket mask, it has a valve that you can breathe in. You can breathe into the patient, but the air from the patient you cannot breathe the air from the patient. It is very active. Although the study shows if you do a good quality CPR, it will also help the patient. It will also help air get into the lungs and out of the lungs. Because when you compress that chest to at least, for even an adult, you do like at least 2 inches downwards, it will also press on the lungs. So which is also helps in on removing some air from the lungs and displacing the air. And then when you release the chest, it requires. So some air from the environment will be sucked inside because of the negative pressure from it. So you can either do the pocket mask, or you can do a good quality CPR.
Yeah, excellent point there, Richard. In here we teach untrained medical personnel. We teach a compressions only CPR. All you're doing is those good deep compressions, and like you said, that gets enough of that chest movement to get some airflow. So as long as you're taking that first step of setting the airway and making sure that there's a clear airway, a compressions only CPR, if you don't have access to a mask or BVM, is a great option. We had a question about if you're dealing with evisceration, do you use a wet dressing or a dry dressing?
When you're dealing with is removed or it's removed direct from the skin, and you can see the bones and the skin is down. So the best thing if you use is a wet dress. It's a wet dressing, because if you use a dry dressing, it will dry up with the wound. So you don't do a lot of wet, you just wet the gauze, and then you tie it, then make sure the patient or the victim goes to hospital for the management. Strains and strains, these are the locations. Number one, on the field, we don't have what you call the X-ray machine or the CT scan that you can be able to actually identify where to take the bone back or what to do next. So number one, we say treat the patient and make sure the patient is comfortable. If it's a leg, don't force the leg go back, or don't force the leg back to its normal position, because you don't know what has happened from inside. So what you do, sprint the leg or the arm just as how you have found the leg, so that make the patient comfortable by not cause a lot of movement, and then make sure the victim or the casualty visits the hospital.
Got a question of, if the patient has broken ribs, what are the procedures for chest compressions for CPR?
When a patient has broken ribs and you need to do a CPR, number one, we have to put consideration. If we don't do the CPR at that point, the patient might die. Then the other thing is, you look the extent. I'm not telling you to judge. I'm telling you to look the extent of injuries. There's some extent. If you get like there's a crash, is a motor vehicle crash, and the chest is completely crushed. I don't think like you can be able to revive that person. You can do CPR and bring back the person, but how much damage will you cause on the patient? So some of things being, Chief Mike, maybe you have tell us how you dealt with it.
So the biggest point is that if a person is in need of CPR, that means their heart is not beating. A person without a beating heart is dead. So anything that we can do to try to make that dead better is good. So if the person needs CPR, the heart's not beating, we're going to do that CPR because they're dead. You can't hurt a dead person, right? So we're going to try to do that CPR to get that heart going again. And when you're doing a quality CPR, a lot of times you will break ribs while you're doing that CPR. You will break their ribs doing the CPR. If you're getting your compressions as deep as they need to be, you'll break ribs, especially on older patients. So broken ribs, I see where the concern comes from. You know, you've got that broken rib, you don't want to puncture a lung or something like that. At the same time, that's something that we can deal with at the hospital later. If the heart's not beating, we're dead. So yeah, you got to go for it. You just have to go for it. If they need CPR, if their heart's not beating, you have to beat their heart for them. Yeah.
Hello.
Go ahead.
Hi, Chief Mike.
Yes,
Hi,
sir.
Chief
How are
Mike.
you?
I'm well, thank you. How are you, colleagues? And I like the conversation. This is Hesbon. Just to contribute a little bit on the issue of CPR and broken ribs, Chief Mike, I think one of the things that we should really consider is that we need to take it seriously. When you approach a casualty, basically, because pre-hospital, I'm looking at a casualty right now. So if you're approaching a casualty and you decided you want to perform first aid for this person, then you have to take it as serious as it is from the word go. Because if your assessment is good, then you'll be able to notice the broken ribs. But if your assessment is not good, then you are not going to be able to notice the broken ribs, and you'll just go for it. Of course, for you to be able to perform the CPR, you have to understand where what we call it the crepitus, isn't it? We call it the cracking sounds that you're going to hear. Where is it? Is it at the sternum point? Is it at the back? So this will also allow you to be able to decide whether you're going to do the CPR or not. But of course, like Chief Maker said, this person does not have life in them. So you have to look for a way to do life. And again, Chief Mike, if I would help you a little bit, I'm looking at the questions and someone is asking that if you don't have a BVM, then how can you administer CPR? I think the current algorithms in terms of offering CPR, maybe we are looking at the COVID protocols, whereby at this point we don't want to give 2 rescue breaths. However, Chief Mike, I don't know what we'd use in place of CPR or BVM, but I know that we go like over 150 compressions all through. That is going to be very effective. So those are my 2 cents. That is my 2 contributions. For one, the BVM, we just do CPR 150 compressions complete without doing any 2 rescue breaths. And then for the broken ribs, we really have to do a proper assessment for you to be able to understand where the ribs are broken. Then you can make a decision whether you want to do CPR or not. Thank you, Chief Mike.
Yes, sir.
Mike.
Fire away, sir.
This is Isa.
Go ahead, sir.
Just to add on what Hesbon had said is that you have to do an assessment of the broken ribs and then you continue with CPR. However, so many people outside there, when they are running and going to do CPR and they hear the cracking sound and they stop. However, like if you are going to do CPR, you have to be serious. If you want to revive this person, then you have to be serious. I remember doing CPR during Westgate and I broke ribs, but I did not stop until the ambulance came up. When the ambulance came up and they took over, and I can say till today, the person is alive. If I did not do what I did, yeah, and I would have left the person there and the person would have died, right? When you're doing CPR, if you break ribs, ribs repair themselves. So if you're going to do CPR, do it as long as you're doing it correctly and you're going to save somebody's life. And if you break ribs, that is okay. Because you are going, those ribs are going to repair themselves, they're going to come back. Yeah. Yes, a bit of pain here and there. Yeah, but at least the person will be alive. That's my point.
I'm with you 100%. If my heart is not beating, you just keep making it beat until somebody else can take over. If you break my ribs, so be it.
Yeah, sure. Thank you so much. Thank you so much, Chief Mike. Thank you for Hezbollah. Thank you for Issa. This is something that we need. I think Chief Mike will have to organize a class on CPR in the near future. You will get some time, you can organize a class for the CPR so that now we can understand the current. We have the current algorithm 20. We have the current that says you don't have to give the breaths. You do, if you don't have the BVM, do compressions. After 150, you check on the pulse. If the pulse is not available, continue.
Yep.
So there's someone else who was asking about is breathing, is a breathing we can't do. I'm yet Alex Nzoki, kindly, if it's possible, you can try to say what you can unmute and make the question clear.
We got one last question here. Timmy, go ahead, sir.
So I have a question.
Yes, sir. Go ahead.
Maybe not a question, but also something to add on the CPR. As firefighters, we have learned about the risk-benefit analysis. So if we tend to have broken ribs, what will be the risk of us not giving the proper CPR, overweighing the need for us to resuscitate this patient? That is what we are going to be dealing with. So the risk will be, yes, we are going to cause further harm to the patient, but the benefit will be this patient after 10 years, he will be saying that, oh, fireman, someone saved my life. So that is what I can say. Thank you.
Thank you, sir. At this point in time, we're going to wrap up the formal part of our training today. I want to thank Richard. 2 weeks in a row with our training. It's very much appreciated. We always love having the local instructors to do that. We thank you for stepping up. If there's any of you out there that would like to lead a class, feel free to reach out to myself or to Jose, and we can get you set up with a topic if you'd like to lead some training with us. As once again, I want to thank everyone for coming today. If you'd like to see this again, you can check out our YouTube page. Just search for Africa Fire Mission on YouTube, or check out the link that I placed down in the chat, where you can follow along and receive your certificate of attendance if you need to take this class later on. I invite you to invite all of your friends and fellow colleagues to join us again next week at the same time. And thank you very much, and we'll see you all again next week.